Today's topic is titled Let's Talk About Hearing. And research has shown that individuals with untreated hearing loss may be more susceptible to cognitive decline and an increased risk of dementia. Previously, we have had clinical neuropsychologist Kate Dupuy come and speak about the connections between hearing loss and dementia. And you can find that recording on our on demand webpage under the topic of hearing. And Michael will post in the chat box the link to our on demand webpage. Today, we're going to focus in on the hearing part of the equation. And I have the privilege of introducing Cheri-Leigh Sewell, who greatly enjoys sharing her knowledge of audiology to help those with hearing loss, as well as to help aspiring students in the field. Cheri-Leigh holds a master's degree in audiology and is a registered audiologist and hearing instrument practitioner in BC. She has experience in private practice with a special interest in a client centered approach to the journey to better hearing. She has been a passionate educator about hearing conservation at BCIT for 19 years. Cheri-Leigh, so pleased to have you with us today. And on that note, I'm going to pass it over to you.
Thank you, Lori. I'm so happy to be here to talk about hearing. Just share my PowerPoint
Sounds good.
and just let me know when you see it.
Yep, there it is. Looks good.
Great.
I'm going to
Yeah.
hide.
Okay. So my name's Cheri-Leigh, as Lori said, and I have been an audiologist for over 20 years now. I became an audiologist because I have a mom and an uncle who have severe to profound hearing loss, and they inspired me to go into the field to help others with hearing loss. They are also teachers of the deaf and hard of hearing, so we're kind of all in it together in the family. I love audiology because I can truly help people improve their communication through various avenues, and it's not just about hearing aids. So let's talk about why hearing is important. As you know, we need to communicate to participate in daily life. We need to listen to those around us and reply to them. We also need to hear what they're saying to proceed with tasks or next steps. We may need to hear a physician or hear the clerk at the bank. When we lose our sense of hearing, we also lose this connection with people and our environments. Answering the phone, conversing in a car, conversing in a noisy restaurant, all may be more difficult when hearing is compromised. Our sense of hearing allows us to connect with our environment, hearing safety signals such as a car honking or a smoke alarm, and it helps us connect with our family and friends. We need to maintain communication to keep social connections, which in turn reduce loneliness and isolation. How does cognition fit in with hearing? Cognition is part of how we hear. We process sounds in the brain, and when the incoming signal is not clear due to a hearing loss, understanding the signal will be harder. This can be even more difficult when cognition and memory are compromised and could lead to gaps in understanding or misinterpretations, possibly confusion. Those with hearing loss require more effort in listening, using more cognitive capacity to understand the message and fill in the gaps. So, by treating hearing loss, we can ensure the message is more easily received and free up room for these other cognitive functions. Listening will overall require less effort by the person with hearing loss. Before we move on with the next slide, I'd just like to say that we need to remember that hearing loss doesn't cause dementia, but we can make improvements to those living with dementia by improving their auditory sense and access to auditory information. If we treat hearing loss, the brain doesn't have to work as hard to decode the message, and the message may be more easily understood. Why should we treat hearing loss in those with dementia? Studies have shown that treating hearing loss may have the potential to improve the quality of life of a person living with dementia. Some of the benefits that have been noted have been improvements in everyday participation activities, decrease in responsive behaviors, a decrease in frustration, and an increase in well being by reducing social isolation and maintaining more of those connections. And it also increases safety. So, by giving someone more access to auditory information, they will hear the phone and they'll have the awareness of their environment. So, just a minute, we're going to review the hearing sense. So, we're going to start from the beginning with this talk and just talk about the parts of the ear. So, this graph shows the parts of the ear. Our pinna, or the outside of our ear, gathers the sound waves that we can't see and funnels them to the eardrum. The eardrum is this pink flap of skin here, and it vibrates in response to the sound waves. Those vibrations also are passed through these three middle ear bones, the hammer, anvil, and stirrup. The last bone, the stirrup, pushes on the oval window and sets the fluid in motion in the cochlea of the inner ear. It's in the cochlea that there's little hair cells that move in response to the sound, and then a nerve sends a signal to the brain. It is in the brain where we understand the message and the meaning, and this all happens instantaneously, as you know. We're just going to watch a short video now that summarizes that. Okay, so I hope you enjoyed that video. It's a good summary of how we hear. We're just going to go over the types of hearing loss briefly. So there are conductive hearing losses, sensory neural hearing losses, and mixed hearing loss. Okay, so conductive hearing loss is when something's happening in the outer ear or middle ear. So that's in the ear canal or in the eardrum, where those little bones are. And some of the examples of that would be occluding wax in the ear canal, middle ear infection, or fluid behind the eardrum, a swimmer's ear or an outer ear infection, or a ruptured eardrum. Sensory neural hearing loss occurs when there's trouble in the inner ear and or nerve. So we don't always know whether it's nerve or the hair cells in the cochlea. Some examples of this would be age-related hearing loss, noise-induced hearing loss, or ototoxic medicines can also cause hearing loss, and some chemicals as well. Also, Meniere's disease is an example of sensory neural hearing loss, and there are a lot of genetic causes for sensory neural hearing loss. A mixed hearing loss occurs when there's trouble in the outer and or middle ear as well as the inner ear. An example of this would be someone with age-related hearing loss, but also with a block of wax in their ear canal. So once the block of wax would be removed, they would no longer have a mixed hearing loss, and it would just be the age-related sensory neural hearing loss. So hearing tests give a description of the hearing in terms of degree and type. It's also important to have a hearing test to rule out any medical concerns with the ear that could be treated to get medical treatment. It's our job as hearing healthcare practitioners to identify the clients who should seek medical care and encourage them to go and get this checked out. This also contributes to an overall understanding of your hearing health. When I sit down with a client after a hearing test, I explain the results and relate the results back to their initial concerns. Often, more information is offered by the client and they learn to understand why they are missing certain sounds. By understanding the graph of the hearing, some of their troubles make sense. Another part of the hearing test is to get the options for rehabilitation. And this can empower you with information and give you the resources to decide on next steps. So I would encourage all of you if you haven't done so already, to get a hearing test. What should you expect from a hearing test appointment? Typically, clinics will give you a few questions to fill out beforehand about your hearing concerns. For example, they might ask you, do you have trouble hearing in restaurants or on the phone or with your spouse or in the car? When you come in for the appointment, they will go into more detail about your hearing health, including your ear health, your general health, things like medications. And as hearing healthcare practitioners, we're always looking for red flags to warrant a referral to a physician. And we can determine this by doing a complete hearing test. Case history questions may also include things about memory, dexterity, independence, and the practitioner will want to get to know what you do on a daily basis. And where would you like to hear better? This is where, if you attend an appointment with a spouse or caregiver, it can be very helpful and you can put information together for the hearing healthcare practitioner. When you have a hearing test, the first step that's done is they look in your ear with an otoscope. And then typically the next step is they're going to measure that middle ear space where the eardrum is and determine whether it's healthy. Then you will go into a small booth and you will be listening for tones. The tones will be soft, some will be loud, but every time you hear a tone, you're going to press a button or raise your hand. They will also do some speech testing. Following these tests, they'll sit down with you and explain the results and make recommendations. The other thing I wanted to mention here is that you see a lot of advertisements for free hearing tests. Typically, these tests are not as thorough as a hearing test appointment that you make yourself that can be up to 90 minutes. This would be more of a diagnostic test. The free test will give you an idea of your hearing and give you eligibility requirements for hearing aids and may only take 15 minutes. This amount of time may not be good for someone who might have some cognitive concerns. It may be too rushed and you won't get enough information. Payment for hearing tests are not covered by MSP unless you go through an ear, nose, and throat doctor and get a referral for a medical reason to a test at a hospital. Tests can cost up to $150, but they may be reimbursed by some extended medical plans. This is what a typical booth might look like, where you would sit in the booth here and the clinician would be on the outside testing your hearing. And these two things here are just different sets of headphones that you would be fit with in order to hear the tones. So some tips for a successful appointment would be to bring your medication list with you and your eyeglasses. Bring a list of your own questions or concerns or why you're there for the day. I would encourage everyone to bring someone with them to an appointment, spouse, partner, family member, best friend, because 4 ears are better than 2. So if you miss something, they can help fill it in. They can also help contribute to the conversation. Always ask for resources and written information that you can read later on at home away from the appointment, and allow time for appointments. We don't want them to be rushed. One thing that works well that I've seen in the clinic is going together for hearing tests. So instead of putting the person on the spot who has a hearing loss, you could go together and both get a hearing test done. I wanted to share with you this app from the World Health Organization. It's a screening app that's free that allows individuals to monitor their hearing. You have to use it with headphones and you can download it from this website. They say it's especially important for people who listen to loud music, work in noise, and anyone over 60 should be using this app to screen their hearing. Once you've completed a hearing test, the results are put on a graph called an audiogram. The audiogram displays the ears individually. The left ear is represented by a blue X, and the right ear is represented by a red circle. Down the side of the graph here, is where loudness is located, soft sounds are at the top, and very loud sounds are at the bottom. Across the bottom of the graph or the top, you will see pitch, from low pitch like a piano keyboard to very high pitches at the other side. Quite often, it is age-related hearing loss that's identified. Hearing loss is typically in the high frequencies. So on this graph, you can see how it slopes down in the high frequencies, and anything above this line is going to be missing. This is an example with someone with a hearing loss from about 2,000 to 6,000 hertz, and we would call it a moderate to severe hearing loss. This type of hearing loss will cause the person to miss soft, quick sounds in the high frequencies, such as S, so S, TH, and F. They will have to fill these in. This is okay given context, quiet environment, and a good communication partner. A person with hearing loss will do okay. However, in group settings, in noisy environments, they may struggle to fill in those soft sounds that they cannot hear. Noise covers up these sounds. Think of the last time that you were in a restaurant or somewhere where you were missing some of the speech sounds. What was happening around you? What was your environment like? This is a sorry. Whenever we're faced with a more challenging listening environment, it takes more cognitive effort to fill in the gaps as well. So this might even require more information and more fill in if someone is faced with dementia. This is also tiring. So if we improve the signal with a hearing aid, for example, we hope the person has a better chance at understanding the spoken message with less cognitive effort. I've provided a link for hearing loss simulations that you can go and check out on the Starkey website. This chart shows where speech sounds are located in terms of pitch and loudness. The pictures are examples of how loud those sounds would be at the pitch. So an airplane is a very loud sound, so it's at the bottom of the graph. And a bird has a higher pitched voice and it's quieter, so it's here in the high frequencies. This shape of hearing loss is similar to the other chart, where things in the high frequencies are going to be missing. You can see that if a sound like S is missed, the meaning of the message may be misinterpreted. Women's voices and children's voices may also be more difficult with a high frequency hearing loss, such as this. For example, if I were going to say, I'm going to buy a cat, someone with a high frequency hearing loss may miss the sound and not quite understand the message. They may hear, I'm going to buy a cap. Another example is the sentence, I can pick you up at the airport, versus I can't pick you up at the airport. With a high frequency hearing loss, as shown in this audiogram, it is harder to hear the in can't. And if this message is misheard, something very different might happen at the airport. Now we're going to switch gears and talk about rehabilitation options. So we're going to talk a bit about hearing aids, assistive devices, communication strategies, and some environmental modifications. I wanted to mention this survey. It's a very big, long survey. 44,000 people respond to this in the United States about hearing aids. In 2022, the satisfaction rate with hearing aids is up to 83%. And the average purchase age is around 60 years. A few years back, it was 69 years old. Time to recognizing a hearing problem to purchasing an aid has gone to 4 years. So if someone first goes for a hearing test, they might not act on the hearing test results and decide to get a hearing aid for 4 years. Before, it was at 7. So there has been some improvements. People are discussing this hearing with their doctors more often, and 2 hearing aids are often used. What do studies say about hearing aids? Studies say that earlier hearing aid use makes it easier to communicate as the hearing loss progresses. Experienced hearing aid users may continue success with hearing aids through the stages of dementia. Hearing aids reduce cognitive effort for listening by amplifying speech and sounds in the environment. The journey for hearing is ongoing with the client and hearing healthcare practitioner, and any concerns about cognition should be shared with them. Our job as hearing healthcare practitioners is to help clients and family members navigate through the choices they are given to improve communication access. Using active listening and empathy and open ended questions with shared decision making, we hope that we can make a difference. This is the beginning of a relationship that we build on as hearing healthcare practitioners with our clients. Hearing aids are not a one time appointment. You can expect to come back to the clinic every 2 weeks or so during the trial period, and then semi annually after. Know that when you meet your hearing healthcare practitioner, you want to develop this relationship and build trust so that they can assist you and your care partners navigate the challenges that may come with cognition changes. A more holistic approach to hearing care with the goals to improve or maintain independence, social participation, and improve quality of life are important. Research has shown that individuals with hearing loss will be more successful with a hearing aid with family and caregiver support. This would be additionally important when someone has dementia. We look at the whole person and their hearing needs. Our goal is to have them live well with hearing loss and improve quality of life. What are some of the barriers to getting a hearing aid? Maybe some of you can relate to these. Some individuals think that hearing aids will make them look old. I had a lovely 96-year-old in my office who volunteered at the airport in Vancouver. Her main reason for getting a hearing aid was to continue to do this volunteering activity that she loved. But her main concern to me was that she didn't want to look old, so the hearing aid had to be discreet. We, of course, worked within these boundaries and she was successful. Some individuals may not be ready to go through the process of getting used to a hearing aid. It does take time for the brain to adjust to the new sounds. You're basically doing some new sound memories and relabeling sounds as you hear them through the hearing aid in a new way. And it takes a commitment. Put them on each day, take care of them, and go to these appointments. Cost is a huge barrier. We'll talk about that on the next slide. Some people are just not ready to accept hearing loss and help. They deny they have a problem, and even though family and friends would like them to hear better and communicate with them, they don't really want to pursue it yet. So, what about cost? Hearing aids are expensive. They range in cost from about 1,000 each to $4,000 each. I would encourage you to check your extended health plans if you have one for some coverage towards hearing aids. You can also check third party eligibility through Veterans Affairs, WorkSafe BC, First Nations Health Benefits, Work BC, and Income Assistance. When you're at the clinic, inquire about payment plans or breaking up the payment for the hearing aid over a few months. Ask about refurbished hearing aids and loaner programs. For example, in Vancouver, there's a nonprofit clinic who has a lend an ear program. And for those who qualify, they are fit with donated refurbished hearing aids at a minimal cost. So, unfortunately, in British Columbia, unlike other provinces, no, our citizens are not given any money towards hearing aids from the government in general, unless you meet those third party providers' criteria. So there is a movement of passionate individuals who are lobbying the government to try to get funding and access to hearing care for vulnerable populations, such as children and the elderly. Their goal is to get the government to invest in a hearing health program for British Columbia. I'd encourage you to check out the website. What are some of the reasons to get a hearing aid? There are many reasons, but these are some of them. We, of course, want people to continue to participate in their daily activities. We don't want them to avoid situations because they cannot hear. We want to improve overall communication, decrease frustration, and stay engaged with everyone around them. Ultimately, the hope is that this will reduce social isolation and loneliness. So, hearing aids, of course, come in different styles. Your clinician will help you make the right choice for you. Some have their advantages and disadvantages. For example, this one here, the receiver in the canal, you may be familiar with it. It has a very thin tube. It's very light on the ear, and it is the most popular hearing aid right now. So, in the past 10 years, up to 80% of people are fit with this hearing aid. It's light, you can get used to it easily, and it has lots of connectivity capabilities. The in the ear on the other end of the graph here is actually very good for dexterity troubles. It's very easy to insert into the ear and to take out. The behind the ear, this would have a thicker tubing and an ear mold. It has the most power capability. So if you have severe to profound hearing loss, a behind the ear hearing aid is the only hearing aid that you should be fit with to do the very best. All hearing aids have automatic functions and provide good sound amplification when they're fit correctly. You don't have to spend a lot of money to get the most of hearing with a hearing aid. Each hearing aid manufacturer has different levels of technology, and the clinician should explain the features and price point of each to you. Realize that these hearing aids are so much better than 20 years ago. When I first started my job, I was given a screwdriver to adjust hearing aids because I could only adjust two settings. Now we have the ability to hook these up to the computer and do lots of neat things. We can do wireless connectivity to smartphones. Most hearing aids have that automatically. There are lots of rechargeable options in the different styles now, depending on the manufacturer. There's automatic volume controls and programs, or you can override those. You could be completely hands off, or you can have control. There's also a lot of noise suppression in the background of hearing aids. And what that's doing is it's detecting speech and noise at all times. It's trying to reduce the noise that it detects and increase the speech signal. Directional microphones are on most hearing aids now, and they are amazing. They pick up the sounds more in front of you than behind you. They're constantly monitoring to adjust for the noise around you. And lately, we have a new layer um, of technology in hearing aids. That's artificial intelligence. And so, an example of what artificial intelligence is doing is, in addition to the automatic things going on with noise suppression, the artificial intelligence will learn a common voice in your environment. So, say a partner or a spouse, and it will learn that that's a voice that's around a lot, and it will start to seek out that voice and enhance it for you. Now, this is what the hearing aid manufacturers tell us, but really you won't know until you try. Remember that you would have a trial period of at least 30 days, but can be up to 90 days, where you can return the hearing aid if you're not happy. During this trial period, you need to go to follow up appointments and bring in your concerns. What's working, what's not. For example, you might come in and say, I am still hearing the cutlery way too loud. And the clinician can go in and adjust those high frequency loud sounds for you so they aren't going to be as startling. You might say, I would like to hear my soft grandson's voice better. I'm still not hearing it as well as I'd like. Your clinician will also discuss realistic expectations. Hearing aids do not solve all problems, but they certainly can help you in many situations. So, I have some tips for hearing aid use and dementia. So, if you're faced with some dementia, it's a good idea to have a hearing aid that works more automatically. So, you really place the hearing aid on your ear and it amplifies the sound, and you don't have to press any buttons. You should have a storage routine in place, and you probably want to select a rechargeable option so that you don't have to fiddle with little batteries. Connectivity to the phone would be important so that you get the benefits of the hearing aid amplification through your iPhone or even through your landline. You can also connect to the television quite easily. There's always a loss and damage policy with hearing aids. It can be 2 or 3 years, so that within that time period, if you lose your hearing aid, it will be replaced by the manufacturer at a minimum cost. For example, $500 instead of what you originally paid. You can also look at putting your hearing aids on your home insurance. Some people have safety lines to their clothes with hearing aids. There's also a Find My Hearing Aid option on apps now where you can detect where the hearing aids are. Always ask for written instructions that you can take home with you to read on your own time, and you need to practice. Always practice, practice with your hearing aids, cleaning them, taking them in and out. When we think about routines, it might be a good idea that wherever you place your glasses at night, you also have your charger for your hearing aids. You take your glasses off, and then you also take your hearing aids off and place them in the charger. Just back to the idea of practicing, you need to wear hearing aids as much as you can, building up from a few hours a day to full time use. This will allow your brain to adjust to new sounds and help make sense of them. Ask people for help. Maybe even say, do I have the hearing aid on correctly? And if not, ask them to help you. So let's talk about some assistive devices. Amplified speakerphones are a good way of hearing at home with a landline. So on speaker, you can turn up the volume, and when it's on speaker, you can use both your ears to hear what's going on in the phone. When you're considering cell phone use with FaceTime or a video call, use an iPad or a tablet, something bigger to get the full visual cues from the video call. You'll likely have a more successful conversation if you can see the full face easily. There's also connection options for the TV. So if you do not have a hearing aid, you can purchase an infrared system to listen to the TV with. This is the picture here. So he's got a set of headphones and he has a little box connected to his TV that he can get the videos or the audio stream to directly. The person sitting next to him who doesn't have the device will just hear the TV normally. It doesn't interfere. Or if you do have hearing aids, you can have a connection box that is connected to your TV that streams directly to your hearing aids. Consider using the closed captions for the TV. So that's the words that come up. It's highly accurate now, and it does fill in all the gaps that you might miss if you are only using your ears. This is a personal amplifier called the Williams Sound Pocket Talker, and it's suitable for use when hearing aid is not. So the headphones are worn over the ear, and then the person directs the microphone at the person speaking. I wish that every hospital, nursing center or care home had these readily available for their clients and family members. It's very easy to use and it does provide a good signal, and it's relatively inexpensive. Hearing aids may be equipped with a telecoil that allows direct access to an auditory signal. How this works is there's a small copper wire coiled around a metal rod that captures electromagnetic waves and converts it to an audio signal for hearing aids. It eliminates the microphone and background noise, giving a direct signal that is clearer for people. You do have to have this T coil on your hearing aid enabled in order to tap into that audio signal. There are many places that have this, such as places of worship, theaters, banks. We've provided you with a list of venues in BC for this. For example, at my bank, they have a sit down area with this symbol, and I can see the wire that is on the ground taped down where the person is in the box. They can put it on T and then hear the teller more easily. So, speech to text apps are up and coming. They transcribe speech in real time to text. They're highly accurate, and your cell phone acts as the microphone. Each cell phone, whether it's Android or iOS, has this actually built in. You don't need to download an app necessarily. You can turn on live captions on your phone. It's built into the phones under the accessibility under settings. There is two apps that are popular, the Ava app and the Otter app. They both work very well. It might be a good idea to consider this if you feel that you're not catching everything that a doctor might say at your next appointment. This way, you can use the auditory cues as well as the visual cues and not miss a beat. So, some things in general to think about are environments that would help people with hearing loss or help with communication. We want to reduce the distance to the speaker. We should be speaking within 1 to 2 meters of each other for best communication practices. Ensure that all the seats have a good line of sight. So sitting in a circle in a living room is better than sitting in a square so that everyone can see each other's faces. Consider removing background noises such as fans, like the hood fan on an oven, TV, music. Those sorts of things just disrupt the signal more and speech sounds will be missed. If you can, carpet your rooms, use absorbent curtains, and in some places you'll see acoustic tiles. And this just allows for a clearer signal that doesn't bounce around everywhere. Good lighting is also important, and avoid a bright light behind the speaker for those with hearing loss looking at that speaker. For example, when my mom comes for dinner, we close the curtains in the dining room and turn on the lights. She finds that the windows put a glare on the speaker and she can't hear as well. We also turn off the TV and the kitchen fan so there's minimal background noise. This really helps her. Here are some tips for dining out. So, when you ask for a quieter table, mention that it's for accessibility. This is a buzzword right now. Go at a less busy time and choose quieter restaurants. Carpeted restaurants with lower ceilings and drapery would be ideal, but this is not always available to us. When you ask for a quieter table, say away from the kitchen, away from the bar and the music, please. I used to tell my patients, don't bother trying to hear at Earl's. Just go for the food because Earl's has high ceilings, no coverings, and hard floors and very large windows, and communication is not good there. Another point is that the person with hearing loss should actually put their back to the noise so that naturally their ears will pick up the speech in front of them. This is an interesting app that you can download. and it's used to search for quieter restaurants and venues all over the place. When you pull it up in your area, you'll see like a red bubble on different names of restaurants, and that would be a loud restaurant versus a yellow is okay, and a green bubble would indicate a quiet restaurant. It's really neat. And you can also contribute and measure the noise while you're at that place and submit it to them. This also helps us make restaurants aware of the need to be quieter. There was an idea in an article that I just read recently that said that we should have quiet times for certain restaurants, like between 5 and 6:30. We're going to encourage the setting to be quieter. We'll maybe have the lights on and the music turned down so people with accessibility needs for hearing or other accessibility needs be able to come during that time and have a more enjoyable experience. So check out this app. Here are some tips to communicate with someone with hearing loss. Speak slowly and clearly. So, not too slow, just 10% slower. Speak slightly louder, but not too loud. Stay on topic, and if you change topics, then provide a cue. So, Mom, we're talking about Hawaii. And then the vocabulary and everything becomes more predictable. Choose short, simpler sentences and make pauses. Use visual cues and gestures. Keep your face clear. Don't put your hands in front of your mouth like this or like move around a lot. We want the visual of the face to be clearly accessible to those with hearing loss. We also want to get the person's attention before we talk to them. So if they're faced away, call their name first and let them turn and look at you before you begin speaking. If you're not sure that they understand the message, have a repeat back strategy where you can ask them, so we're going to go to the store. We're going to go to the store, right? And you can ask them and make them realize, yeah, we're going to the store. So confirming the information is important. What about tips for the person with hearing loss? Advocate for your listening needs. I can't stress this enough. I have a hearing loss. Would you please speak more slowly to me and more clearly? I have a hearing loss. Can you just repeat that? I didn't catch what you said. I have a hearing loss. Is it okay if we move out into the hallway and have this conversation? Because this room is too noisy. My hearing's not so great. Can you please face me when you speak to me? So, advocating takes all forms, and it's very easy to nod and agree when you really didn't hear the message. So, I encourage you to make an advocacy effort, especially if you have hearing loss. So, a couple little things that we can just go over as our last slide are looking for peer support. Um, Groups in your area. You guys are from all over. I know, like on the island, the Island Deaf and Hard of Hearing will often have some hearing loss groups get together. There are a few in the Lower Mainland here. In Vancouver, there's a course called Living Successfully with Hearing Loss through Vancouver Community College. Now, this course is completely online Zoom now. And and sorry, someone just walked in. Um, It's completely online and you can just sign up from wherever you are. And it's about 10 weeks and it gets everyone together with hearing loss. You learn a lot through it. These groups are important to maintain social connections. Some clinics will have groups that they run on the side. You can also learn things about lip reading and auditory training. The World Health Organization has a statement on social prescribing to keep connection and to prevent loneliness and depression and to keep in good health. This will ultimately improve the quality of living. The WHO says, that's the World Health Organization, says that social disconnection harms the brain and puts people at risk for memory and dementia. Social connection protects the brain and therefore may have a positive effect on cognitive changes. So we've added some of these resources to the page that's been provided, and I'd encourage you to reach out and check out some of these supports. Thank you so much for joining me. I apologize for some of the technical glitches, but I'm very happy to be here today with you, and I'd love to hear some questions.
Hi, Cheri-Leigh. Thank you so much for that presentation. We have actually received quite a number of questions. I've kind of uh, ordered the ones that I think most apply to your expertise as an audiologist first. Lori's been good enough to respond to some of the more dementia-related questions in the chat, but we'll see what we can get to. Um, First question here: how does tinnitus fit into hearing loss?
Oh, yes. I was thinking about tinnitus, and thinking, oh, I didn't put a slide on that. So, tinnitus is very common with hearing loss. Some people will have tinnitus without hearing loss, but most of the time there's hearing loss associated with tinnitus. There's many reasons that people have tinnitus, and we don't always know what that reason is. One of the most common reasons is if you've worked in noise, then you might have some ringing in your ears. 1 in 5 people actually have tinnitus on an everyday basis. So if you do have tinnitus, the first step would actually be to get a hearing test to look at all the other parts of your hearing, but you might not always know why you received the tinnitus or you got the tinnitus. I could talk for an hour on tinnitus.
Okay. Um, Most hearing clinics do not have an audiologist. Does that matter?
That's a good question. Of course, I would encourage you to seek out an audiologist, but here in British Columbia, we do have hearing instrument practitioners and audiologists working the same job. I think the most important thing is that you trust the place that you go to. There are very good practitioners all over the province. And I don't think that that should be a barrier to you getting a hearing test. If you have a friend who likes their hearing healthcare professional, go with that person or a recommendation from someone else.
Okay. This is a question about hearing. Can you educate when persons have hearing aids and when brain tires and history of vestibular and brain injury can then start talking super loud when trying to process thoughts to words? And when brain tires, overstimulating environments, sounds will startle much easier. So I think they're just asking you to speak to that phenomenon. If you,
Um, I don't know about the vestibular part, but one symptom of hearing loss is the unusual growth of loudness. So if you have hearing loss, your range of hearing is different than someone who doesn't. And so the sounds that you just barely hear will be a lot louder than someone with normal hearing. So you have a very short dynamic range. And what that means is that you might hit that loudness level sooner than someone with normal hearing. I think you mentioned tiring. Was that in the question? Like getting
yeah,
tired of loud sounds or, you know, someone
yeah,
with
when
hearing
brain
loss.
tires, yeah.
Yeah, so hearing loss creates an active listening phase. So when people with hearing loss are listening, they're always having to attend, and it takes a lot of effort and it can be tiring. And so the brain and the processing of those sounds does get a little kind of pooped out, as you will. And you might need to take a break from all that stimulation. Not sure if I'm answering the question correctly, but hopefully that helps.
My partner has had hearing aids for 10 years or so, but over the last year, he has begun to find it difficult to process vocal interaction. This is not simply the loss of hearing, in e.g. higher sounds, but a complete mishearing of a word, even when clearly repeated. The neurologist says it may well be related to a neurological degeneration. Where can I find
Mhm.
out more about this, including the usual time scale and related behavioral changes?
Um, if I don't know if I'm the best person to ask that question, to answer that question. There are a few papers about like hearing assessment and rehab with people living with dementia, but I'm not sure that's what's going on with that. Sometimes, it's been shown that clearing up the signal and maybe even using one hearing aid versus two can help. That's been shown in the literature, as well as just slowing down and getting a different way of putting the signal out. So maybe writing it or using different inputs rather than just the auditory. Does that help you? I'm not sure I'm
Mhm.
the best person to answer
Yeah.
that question.
Yes. Some of these remaining questions are definitely more towards relate to dementia, and you might not have the expertise. You might not have the background to answer them. I am going to pop in our 1-800 number to our First Link Dementia Helpline in the chat too, if there's anyone who has any other questions that need to be dealt with. For this next question, how can you determine whether a person with moderate dementia who has never had hearing aids will be able to adapt to and successfully use them? This is a person who doesn't want to wear her glasses, for example.
Yeah, that's a tricky one. So you have to look at the overall person and the supports in place. Like where are they living? Are they going to be able to put the hearing aid in by themselves? Because if they're not able to wear their glasses, they might actually reject the hearing aid. You could do a trial period, or you could use one of those pocket talkers with the headphones for when you're together and having conversations. This might help get an idea whether the amplification will help with them before pursuing a hearing aid. So when you go to an appointment, the hearing healthcare practitioner should be asking you all of these questions, and determining what's the best route for you and your friend or person.
Next question. Do you know of any places where they can help you relearn auditory processing, communication, exposure to rebuild noisy, high stimulating environments? I wear hearing aids and love them, but have huge goals that one day I can volunteer at airport.
Oh, that's amazing. There is an auditory training program that some clinics offered called LACE, LACE. And it is a program that you have to commit to on the computer, and you do exercises and practice every day with it. And it actually now can be ongoing, and it changes the programming based on how well you're doing at the tasks. So you can practice those skills. There are a few apps for that as well, but the LACE program is the most popular. And on the resources, I did put a link for Hira, which I didn't mention in the talk, but she actually has a link for LACE on there that you can buy that auditory training program. I'll try to think of some of the apps too, if people are interested in that, and I can add that in and give those to Lori.
Okay. My mom is in the denial stage. Is it okay to let it go until her hearing is worse before getting hearing aids?
Well, I would say I hope your mom's had a hearing test, and encourage everyone to do that first step as a first introduction and then go from there. So if she hasn't had a test, my goal would be to get her in for a hearing test. And then maybe introducing smaller things like using that small pocket talker amplifier, or letting her know that you'd like to have more meaningful conversations and then she's missing some of the information. Make sure that she's keeping up with all the activities that she wants to. It's never a good idea to force someone to get hearing aids, but small steps in encouraging them to recognize that it's not only them who's having the trouble, it's also their caregivers and their family members who want to communicate with them.
Someone else wanted to know, can you have a hearing test at home?
Uh, Well, there are vans that come. I think Here at Home is a company, that will come to your house, and then they have hearing test equipment that you can go out to the van to use. There's also some places that do bedside testing and will bring the equipment to into the home. You'd have to look and call around to the clinics in your area. That would be for more of a full hearing test. If you want to use an app and just get a quick idea, that app you can use is the one that I suggested on the resources. Yeah, so I would call clinics in your area and see if they do any home testing. I know in the Lower Mainland there are a few.
I need suggestions of a better phone for my 94-year-old mama. A regular phone doesn't work for her. It's exhausting to talk with her due to repetition.
Okay, so if it's a landline, then you would want to look at an amplified speakerphone. I could get give Lori the suggestion of the name brand of it. Like there used to be one called William Sound, or you can look at the website ALDS, and they're a local company that sell these assistive devices. And he has all of the availability of the landline phones. So ALDS.
Uh, could you help a dementia lady refuse to use hearing aids but very hard of hearing? My mom's TV volume already up to 36 now, and she wants TV on all the time. Our ears hurt by the noise and headaches sometimes.
I would suggest if TV is a big focus of her day, to get a TV listening device for her. So a set of headphones, even from London Drugs, with that infrared system, and connect her to the TV directly. She'll get a better input, and then you won't have to hear that high volume, and she won't have to listen as high either. So even though she won't wear the hearing aids, you can get a separate device just for the television. And ALDS actually will have that too.
Someone else says, I gather there is no hands-off hearing aids suitable for older folks with dementia and resistant to change, who would need it and inserted and removed for them each time, and that they could not easily removed. So,
Hard with the no removal. People can put the hearing aids in, and then we can get a cord and attach a cord to the hearing aid, so that if they do pull it out, it would be hanging on their clothing or something. But you can't really glue them into the ears. But certainly, it might be worth it to try, one hearing aid while you're able to talk, when you're there talking to the person. So maybe they can't wear it all the time, but in order to have a meaningful conversation and get a good amount of information out of them and get them responding, when you're visiting or when you're with that person, you can put the hearing aid in when you're with them 100% of the time and make sure it doesn't get pulled out. That's a tricky one. But the actual function when it's in the ear is very automatic. Even the settings that can be set in the hearing aid based on the hearing loss can be set without the person present according to their audiogram results. I
I
hope
think you've
that
answered
helps.
most of the questions I have. So if anyone else has any questions, I'd encourage them to put them in the chat now. I do see one other one. Someone said he has dementia and refuses to wear his hearing aids. Now, he probably doesn't have the capacity to put them on or know when he needs adjustment. What
Mhm.
could be done?
Well, if you're with that person, like if it's your partner or spouse, then encouraging hearing aid use when you're present, so that you can converse and have them try it with help. So it would be harder for that person to be on their own with the hearing aids, but maybe when you're having breakfast together, you can help them on and then you can use them. In terms of the settings, I mean, I would assume that that would be done by the clinic. And if he wears them and he's not visibly uncomfortable with, and he's hearing better, and you can tell that, then the settings should be okay. It's a good idea to always follow up if you're concerned about like the level of sound in the hearing aid.
And there's a follow-up on the question about hands-off devices and
Yes.
possibility. Um, she is 99. How many appointments would it take at a minimum, including the audiologist testing?
That's a good question. So, I mean, at a minimum, so you have your initial appointment, you'd have a fitting appointment, and a couple of follow-ups would be, minimum 4 to 5 appointments to get it going. Some people would say less. I am on the client-centered care. I want to do everything I can to make it the best, but at a minimum, 3 to 4 could probably be done. Might be able to find someone to come to her house too in the area.
Or should I go, another follow-up, or should I go with a
Oh,
personal amplifier to see if that helps enough?
oh, of course, if you think that the hearing aids are going to be too much to do, yes, try a personal amplifier. Like the one I mentioned, the Pocket Talker in the talk. You can actually get that on Amazon or through ALDS. Try that because you want to have the interactions with that person be meaningful and you want them to be able to hear you, and they'll need some amplification.
Great, he says, thank you. Another question following up on the LACE program. To do
Yes.
LACE AI reteaching, do you need an audiologist to set it up, or is it something you can download and do for free? And how long is the course? Thank you.
Okay, so it's actually just changed recently. It's not the Lace AI is at your own pace. It's not free. I think people charge between $300 and $400 with unlimited access. And the thing about the AI part now, because that's a new title for it, is that it learns. So as you go through the tasks, it's going to make them harder or easier depending on how you're doing on the tasks, and it's at your own pace. So there's no pressure to do, it in 10 weeks. You could take a year, or you could take two, or you could go back to it. It's unlimited access once you have it. Does that help?
Just want to, it's Lori.
Mhm.
I just want to confirm as I'm putting this in the chat. Someone has asked, what is ALDS? And I'm
Oh,
assuming that's assistive learning
listening
device,
device.
listening device.
Yeah, they're a company that's been around for a long time that carries all the assistive listening devices. Let's see if I can find their website. Yeah, Assistive Listening Device Systems is the name of their company. They're local, actually, out of Vancouver. But they will have pocket talkers, amplified phones. They'll have infrared TV listening systems. And the man who owns it's very up on the latest devices. Yeah, there it's on. Yeah, you put it. I see it now on the chat.
Great.
Yeah.
I don't see any other questions in the chat. I may have missed one, I'm sorry, but
Yeah.
do see someone shared their experience. By the time my father agreed to hearing aid at age 80, the audiologist said his brain has disconnected with soft sounds like sh, SF sounds. Too many years, so the hearing aids couldn't help much.
Yeah, I haven't heard a statement like that, because it could help in other ways,
Mm,
right? If
mm.
there depends on the hearing loss, we would need more information. But we want to keep the connection with people, and the interaction and having people be a part of whatever is going around, a restaurant, a family gathering. We want people to maintain those connections. And my hope is that the hearing aid would provide some of the auditory input. Even if bits were missing, some of it would be filled in and they could participate more fully.
Lori, did you have the um, final slides?
Well, I guess I could do that. I wasn't actually going to bother with
Oh,
slides.
okay.
Just let people know to please fill in our evaluation. Michael will drop that link in the chat box. And for anyone who just wants to type it out, it is um, alzbc.org/webinar feedback. So we really appreciate if you do provide us your feedback. Let us know what you thought about this. I know from the chat, a few people thought this would be more connected to hearing and dementia, and so we're looking for more of a research focus. But I also see that we got lots and lots of questions that were exactly the reason that Cheri-Leigh came to speak to us today. So Cheri-Leigh, really, really appreciate your presentation, really appreciate the information. And it's clear that there are people who really found that helpful and so appreciate it.